and thank you for sharing your story.
Of course. I want to say that I'm so happy to hear everyone else's story that came before me. And sadly, I can relate to a lot of what they went through. I'm sure a lot of people on this call have had births which is unfortunate. But to get into my story, I have three births. So I'm not going to get into the nitty gritty details, but suffice it to say that I can relate to a lot of what we've heard earlier tonight. But I do have a couple points that I want to talk about. So my first pregnancy was unexpected, but welcome, and it wound up ending in a stillbirth at 18 weeks. Technically, stillbirth isn't until 20 weeks, but for me, I think that miscarriage doesn't quite cover what happened. So I had a baby with Turner syndrome. We lost her at 18 weeks, and I didn't have any physical symptoms after the birth. I recovered physically okay, but I do want to say that now that I'm in the women's health space, I have seen that people who are dealing with perinatal loss do have needs after, during pregnancy and after birth. And so I think it's really important that we consider that and be sure that we know how to use language and have handouts for people who have gone through birth but don't have a baby afterwards, right? That's really important for us to be aware of, because it may be rare, but it's definitely important. But so that's how my journey with motherhood started. And then after that, I got pregnant again about 2 months later and wanted a natural birth, wanted to, go through without an epidural and just have a healthy baby. That was the goal. But because of the trauma of having a stillbirth, I couldn't bring myself to prepare for birth because I thought, I know how this could end. And if I put all this time and effort into preparing, and I wind up, in the same situation, it would be even more devastating. So I didn't prepare physically, emotionally, I don't think. And what wound up happening is I had something very similar to what Dr. Bradford described. I had an OP baby, so occiput posterior or sunny side up. It took forever to push him out. It was very, very difficult. I had an epidural that didn't work, so I could feel everything, and wound up with an episiotomy and being stitched up before the lidocaine had taken effect. I had a grade 3 tear, but I had a healthy baby boy. So at the end of it, I was like, okay, we've got a healthy baby. I'm healthy. I was happy with that, but I knew going forward that I didn't want to have that kind of experience again because it was very traumatic. My blood pressure was through the roof. My temperature was through the roof. I was on a non-rebreather mask for oxygen. It was not a pleasant and peaceful experience. And after that experience, my OB, who was okay, I mean, she gave me an episiotomy, which I wasn't a fan of. But I was in a space where I could focus on my physical recovery because mentally I was in a better place than my first birth. But I wound up having some pain with sex after, about 8 weeks. And I went to my OB and told her, and as a PT, I didn't do pelvic health at that time, but as a PT, I said, I think I need a pelvic health PT referral. And she said, no, you just need this, topical estrogen. You're fine. And she prescribed that. And I remember thinking like, I should probably advocate for myself a little bit more, but my son was breastfeeding only at night, and we weren't getting any sleep, and I was about to go back to work. So I decided not to pursue it any further. And it was kind of like a Band-Aid that worked for a little bit, but then I got pregnant with my daughter about 4 years later. And by that point, I really prepared for birth. I did hypnobirthing. I did spinning babies. I did all of the things that I needed to do to avoid the situation that I had with my son. And, by that time, enough time had passed that I felt like I could really kind of go all in with preparing for this birth experience. So that's the one good thing I'll say about having a traumatic birth experience is if you get another chance to do it, you can change things and hopefully find a team that will support you in that. So I was able to do that. And I was really fortunate to have just the most amazing experience. It was not a natural birth. I did have an epidural, but it worked. And it was kind of like a walking epidural. So I was able to move and adjust my pelvis and that sort of thing. And my daughter came out, and I felt in control the whole time. So I wound up getting an epidural when I didn't want one. I did have to be induced because of hypertension, but I still felt like I had a say in all of the steps, and that made it such a positive experience. So knowing that I had prepared and was able to give my input was really important to me. The unfortunate thing about that birth is that about an hour after my daughter was born, she had to be transferred to the NICU. So, and I had another third degree tear, right? In the exact same spot where my first one was, which I think could be a result of the fact that I didn't go to PT. I didn't work on as much tissue mobility as I could have. I had this scar that essentially just ripped open again. And this time it was a lot more painful. And again, I wanted to get pelvic PT, but I had a baby in the NICU, and I couldn't focus on that. And then, this is one of the things that started me on this course of like wanting to help NICU mamas, because I would have loved and it would have benefited so much from having someone come to me while I was in the hospital and say, like, what can we help you with? Because I did not have the bandwidth to go to someone for my issues. I was way too focused on that NICU experience. And so that was, an unfortunate part of that recovery. And that wound up, I think, resulting in me taking a lot longer to recover from that grade 3 tear. So that's my story. I just wanted to share, there's a lot in there, but just want to share that, like, take care of your mamas with perinatal loss and kind of think about what they've been through, and then take care of your NICU mamas because they need it and they can't always come to you. So you got to go to them sometimes.